Whether you're trying injectables for the first time or making a change to a new provider, the more you can learn about who your injector is before you're in the chair, the better that appointment will be. You're listening to Meet the Injector. Thank you for listening to Meet the Injector. My guest today is Geneva Eagon. She is a PA in Portland, Oregon at MD Beauty Lab and Portland Plastic Surgery Group. It's nice to have you on the show today, Geneva.
Thanks for having me. It's fun to be here.
So how long have you been an injector? Tell me about the path you took to get there.
Well, I have been injecting at MD Beauty Lab for about 3 years. And before that, I spent a year, 2 years just doing Botox. So I was injecting for 5 years, I guess, but started adding in all the different things when I started at plastic surgery. So
the first 2 years you were working somewhere else and all you did was Botox?
no, I was working in it, kind of a weird combo. I did family medicine mixed with dermatology. And so since I was doing the skin derm stuff, I was doing Botox there too. But since it was overall a family medicine clinic, we weren't doing like filler and Sculptra and they didn't know all the things. So I was like, just one other gal and I were like, we need to do some Botox here because our patients were asking about it. And so we had another person that trained me over there.
So you just kind of raised your hand and said, I want to learn to do this?
Yep, that's where we're at. I worked in derm before. I went to PA school, so I saw that whole world. We did both medical and cosmetic derm. So
it wasn't out of the blue. Yeah.
No, it wasn't super random. And then did a couple of rotations in derm and kind of in PA school and was leaning towards the aesthetic route of that.
Did you go to PA school there in Oregon?
I did, yeah. I went to Pacific University. I'm from Oregon. I went to all my school in Oregon, so I haven't traveled far.
Oh, yeah.
Yeah.
Where did you grow up?
In Portland. About 15 minutes from the office.
So you're right there at home in the neighborhood, kind of.
Oh, yeah. Portland. Went to high school in Portland, then went to college, Oregon State, so an hour and a half away, hour and 15 away. Then went to PA School at Pacific, which is in Hillsboro, and then we're back here.
And so do you live in the neighborhood you grew up in now?
No.
Oh, okay.
I guess technically it's still Southwest Portland, but it's a different little nook.
Got it.
But, once you have all of your family around, it's hard to want to go anywhere. And my husband's whole family is around. And so we're happy wwhere we are with our community. So
no reason to leave.
No. Found a good job. Love it here. So
do you have a little one?
I do. Yes. He's 10 months today.
Oh my goodness.
He's a big boy now.
Wow. Okay. So you have a lot going on. You kind of have 2 jobs there, right?
Yeah.
Well, 3 including your son, but at work in the building there, you have 2 totally different jobs.
Yes, we're doing at least 2 different jobs. Yeah, doing the injecting is one, which is on the MDBL side, and then operating in surgery, which is the Portland Plastic Surgery side, and then I'll sometimes see some post-op patients. If there's like a issue going on with surgery, then I can pop over and see them. But a lot of operating, and then I run the weight loss program. So I would say
that's my next question.
3 different.
Yeah. Tell me about the weight loss program. How did that start?
It started after we went to a conference a couple years ago in San Diego, and I was like, I actually had been prescribing GLP-1s like back in family medicine, so for diabetes before we knew they caused weight loss. And so I was like, oh yeah, I love these meds. They work super well for blood sugar and patients do really well on them. And I was like, yeah, and my patients lost weight, but I wasn't, intending them to lose weight at the time. So I was like, yeah, these meds are great. And then when we were at a conference, I started realizing that, we're in the realm of we are able to prescribe them for our patients here. And it actually was because when you want plastic surgery, sometimes you need to hit a weight goal before you have surgery. So we used to just be like, oh, you want a tummy tuck, but it's safer and better aesthetically if you lose 20 pounds before. And so we'd say, okay, bye, see ya, go lose your weight, come back. And now we're like, hey, we can help you get there. So that was kind of why we brought it on, was just kind of for our patients that were
Yeah.
in the group already that were hoping to have surgery.
It's
And then it
funny.
has extended now, but
It sounds like the olden days when you describe it, but it was really only about 2 years ago,
it was only about 2
right?
years ago. Yeah.
Yeah.
Yeah. It's crazy how things have popped up so quickly. But
And become normal, I think.
yeah. And now it's just, I mean, I tell people it'd be nice if it was just in the water because it's good for everything, right? Your blood sugars,
So true.
the dementia risk, like all these crazy things. I'm like, it keeps coming out. Oh, it's good for your kidneys. Oh, it's good for your heart. Oh, it helps you with weight loss. I'm like, yeah, at some point, just like sprinkle a little bit around.
I agree. And they even really stopped doing all the scary, weird side effect stories. Like those really subsided, and I don't know where they were coming from, but I'm not hearing them now.
Yeah, which I say a lot. It's like it typically, when you have these like trendy medications, it comes out a little bit later that, oh, they're so bad for all of these different things. But it's interesting that it's kind of the opposite with these meds. Like, oh, it's so popular and trendy. What's going to happen? And then they're like, oh, it's good for this. It's good for this. It's good for this. Oh, and this is how it helps your health too. So it's kind of, yeah, that's fun.
Mhm. So in 2 years of doing that, surely you've heard some patients say some pretty cool things about weight loss at this point.
Absolutely. Yeah, patients are so happy. People just feel a lot more confident. And I tell patients too, it's not like it's this magic drug, it's a tool. So if you're not putting in the work, it's not working. I think a lot of the things out there that people talk about with the GLP-1s is that, oh, you're just like taking a shot and then you lose all the weight, but it's helping you. You have to be exercising. You have to be eating well. It just kind of gets you more in tune with your body and helps you to
Mhm.
follow that. So, yeah, I think it's a helpful tool for a lot of people.
I've also heard it can keep you from eating enough, and that also can backfire. Like your body can just say, "Hold on."
Yeah, absolutely. I mean, you have to really be on it of monitoring what you're eating so that you're hitting those protein goals and actually getting enough, which, is true of like really strict diets too, is like if your caloric restriction is too intense, then your body's like, oh, I want to hold on to all of this. And then it makes it even harder to lose weight. Or if you're losing weight too rapidly and not eating, then you're risking muscle loss, which is actually one of the bigger side effects is losing muscle. So we talk a lot about like hitting protein goals, getting those weights going so that you can combat that. But if you do it safely and it's managed well, then it's a great medication for people.
Mhm. So you have really kind of 3 areas that you work in. You're doing weight loss, you're doing Botox fillers. Are there any other med spa treatments that you do yourself?
Yeah. Sculptra is a big one.
Oh, yes.
PRP or PRFM, do some of that.
What's that one
Filler.
for?
That one, most popular is for under eyes. It's where we like draw your blood, we spin it down, we take out the plasma, the growth factors, the good stuff, and inject it right back into your face. So it's like more of a natural route to go. Adds a little bit of volume and then can help with other, stimulating collagen, stimulating growth factors. So a lot of people will do that under their eyes if they're not a good candidate for filler under the eyes or other treatments there. But you really can put it anywhere.
Have you done it yourself?
PRP, yeah.
Yeah.
I actually have done, gosh, we have to try all the things, right? So we know
Yeah.
what to talk about. So I can actually explain it. I've done it under my eyes a couple of times. And then I actually have been working on my hair, which is an interesting one. So I lost a ton of hair postpartum. And so now I'm getting that back on by injecting it into my scalp to stimulate hair growth.
How often can you do that?
So it's typically every like 6 to 8 weeks or so you do a treatment. We recommend about 3, but you kind of see where you're at. And so we're doing that. And then, to really get on top of it too, I'm also doing RF microneedling on top of that. So it's a super fun appointment. You go in, you get your scalp poked like 1,000 times. um, we do, okay, I'll walk you through it. Draw my blood, spin it down, take out the stuff that we want to re-inject, and then we inject it kind of all over the parts where I'm losing hair. So, certain people it's all over. For like me, for a lot of postpartum, it's like right here you need more.
Yep.
So we're injecting that. And then I go in and see Martha, our esthetician, and she will use the radio frequency microneedling, which is pretty quick. It takes like 10 minutes, and just like do that all over those spots too. So it really gets it stimulated.
Does it hurt?
I mean, it's not, you do topical numbing. I wouldn't say it's
on your head. So
painless.
You have, like, is your head all greasy with the numbing cream? And then
yeah. Yep. So I have to.
Does it get all bloody when she does the microneedling?
No, it doesn't get bloody.
Okay.
It just looks like I haven't washed my hair for a while. So I try to plan it for the end of the day. But I've definitely seen patients where I have like this greasy scalp afterwards. And it doesn't, like, you don't look weird except that it's greasy. It's not like there's blood or like, I don't know, discoloration or like swelling or anything that looks crazy. So I will walk in.
Put a hat on, like if you're a regular patient. And
if you're a regular person, for sure. I mean, I just stroll up in a in a sombrero into my patient's room. No, I just walk in and I'm like, I promise I washed my hair, but this is a treatment that I'm doing. And most patients don't fault me for that. And then you wash your hair and you're fine the next day.
And is it working?
Yeah. Oh my gosh. Yeah. Yeah, I'm taking before and after photos. So I'm like, okay, baby's 10 months now. And so I don't think I started until 6 months postpartum or so. So it's been maybe 4 months. But I took some photos before, and I took photos at like 3 months, and it's already has helped a lot.
And then you could probably feel it too when you touch your hair.
Oh yeah, for sure. We'll see how it ends up, because I'm going to take more photos, I think, at 6 months, and then I'll share to the world.
And then are you also taking Nutrafol too?
And I'm taking Nutrafol. Yes, that was my next thing. Yeah, the whole package.
Okay, I know what Nutrafol is, but why don't you tell us so we know?
Yeah, so it's a supplement that is for hair. So all we used to really do was tell people to take biotin, which doesn't do all that much for hair growth. So Nutrafol helps stimulate hair growth, helps to keep your hair stronger so you're losing less of it, helps to keep it in the cycle where it doesn't fall out. So Nutrafol takes a while too. It's like 3 months until you maybe start noticing. They say about 3 months till your hairdresser starts to notice changes, and then 6 months or so till the general public will start to notice. I love it.
People walk by you on the street and go, wow, look at that hair.
Yeah, that's what I'm hoping to get to. I mean, my hair is getting longer, but it was like bald patches. So people are like, oh, your hair's so long. I'm like,
really?
Oh, but don't look at this. It was crazy.
You had bald spots?
Like, I mean, yeah, if you kind of pull your hair back, it was like little bald spots. It was crazy.
Oh my gosh.
Yeah, it was terrifying. But luckily there are treatments out there. So if anyone else is scared.
Nutrafol makes a postpartum.
They make a postpartum supplement. Yep. And then they make a regular women supplement. Yeah. So I was getting it. We didn't carry it here. And so I was buying it for myself on my own. And then we kind of talked about it because we're doing some hair stuff here. And I was, yes, we need this. This supplement is incredible. It turns out it's cheaper to buy it through the Portland Plastic Surgery MDBL website, like when you buy it through an actual office, than to buy it online. So everyone should know that, because I was wasting my money buying it online.
It actually costs less if we come in and get it from you.
Yes, and you can get it through our website still, so you can still get it without having to come in, without having to get it or pick it up. I think they still ship it to you, but it's cheaper to get it on through us than it is to get online. So don't be silly like I was.
Good to know. That's a really important, very hot tip, Geneva.
It's a good hack.
You.
Yep.
Yeah. Okay, so we've covered weight loss, Botox, fillers, Sculptra, hair loss. Did we miss anything?
Oh, no. No, I mean, surgery is kind of the other things that I do. Oh, I also do like procedures in the office, like removing moles or cysts or those kinds of things.
That derm background, that's really handy.
That'll help. Yep. Or like suspicious lesions. Yep. Any of that we can take off.
In derm, a lot of times there will be, just in general, In one of the first projects I ever worked on, there was one dermatologist. They had 6 offices, and PAs ran all the offices
Yeah.
because they could do pretty much everything that the MD could do, right?
Yeah, derm is really common to not see. You choose your provider, so you could either see a PA or you can see an MD, and they don't really intermingle unless obviously you have questions. So you can always have somebody pop in, but you can run it
So
as a PA.
is it accurate to say if you called a regular derm, it might be 6 months or a year before you can actually get in to see a dermatologist,
Mm-hmm.
but that if you called MD Beauty Lab and just wanted to see Geneva, you could probably get in much faster?
I mean, yeah, but I'm not going to do your full skin exam. You still got to see a derm for that. But if you're like, oh, this is a mole that I want gone, you could definitely see me within a month, and you can see a dermatologist probably within 6 months to a year. If it's like I want all of my moles checked and I have a history of skin cancer and I have to come in every couple of months to get this looked at,
Yeah.
I'm not your girl. But if it's aesthetically you don't like this spot, or you're like, I just want it to send out to the lab, like this is a mole I'm worried about and I don't want to wait a year, I can definitely take it off and send it to a lab. So yeah.
We're just uncovering all kinds of good
I
stuff.
was wasn't planning on even bringing that up. You brought it up. Great.
But
I
what
forgot
I
that we
like
even do
about
that.
it, yeah, is that you have a really deep experience in skincare beyond what we might find in a med spa that's not run by 4 plastic surgeons.
True. I think that's what is cool. Cool about MDBL is that we are with a plastic surgery office. So we have
Yeah.
that expertise. So yeah, I mean, is it pretty common that a patient will come in for Botox and then they're like, I don't really like this like spot right here. Can you just
Make it
zap
go
it off?
away.
And I'm like, actually, that looks like a spot that needs to be surgically removed. So we're going to schedule that for in the office procedure room. I'll take it off then. Or like, yeah, that's a little spot that I can just scrape off. But I don't think if you went to any med spa, would that be something that I would be comfortable with someone doing? So we're plastic surgery, so we can do that.
Yeah. You kinda light up when you talk about it. Do you remember, back in your derm days, being really into skincare or being really into parts of it and not other parts of it?
Well, yes, because I was I was in kind of general family medicine, then weaved into the skin route because I was like, I like procedural work. So that was kind of what I figured out. Wasn't sure exactly what route I wanted to go in, and that's why I started more broad. And then you find out what you're interested in, and you're like, oh yeah, this is cool to I like to work with my hands and do and make things look good. So
Yeah.
turns out this is the place to be.
And then so how did you, find MD Beauty Lab in Portland Plastic Surgery?
I was debating whether I go into full-time derm or go into plastic surgery. I wanted to do the injectables as well, and then I was like, "Huh, if I mainly like doing procedures, then you should probably be interested in surgery." And so I was like, "Oh, let's go talk to them, see what we think." And then I came and met the team here and fell in love, and so I was like, "Okay, this is it." It was more of like uh, a risk jumping into a totally different field, but
Yeah.
it was really it's the surgeons that I met and Colleen, the other PA, but the
Yes.
surgeons that work here that I was like, yep, these are my people. I need to be here.
You cannot. Colleen is so special.
Oh yeah, she's
And
incredible.
yes.
I told her, I don't even think she remembers this, but when I was interviewing here, I think it was like the second interview, so maybe I knew her a little bit, but I hadn't met her before I interviewed here. I hugged her at the end, like saying goodbye on accident because it's like, it's an interview. Who does that? Like you shake hands, it's professional. But it was like, it's Colleen. And so I was like, okay, bye. Gave her a hug. And I walked out like, I just hugged someone that was interviewing me.
That
But
is
that goes to
awesome.
show like that's where you're meant to be if you feel like you need to hug the people that are
It's a pretty
interviewing
good
you.
sign. Yes.
Yeah.
I once, was at an interview that I didn't know was an interview, and they asked me if I wanted a snack, and the answer is no. When you're in an
Yeah.
interview, you don't
Yeah.
ask for a snack. Well, I didn't know it was an interview, and so I was like, "Sure, I'll have some carrots and ranch," and so I sat in the interview eating carrots and ranch.
Yeah, great sign as well.
And I still didn't know it was an interview until later. And then I was like, oh my God, I ate carrots and ranch in my interview.
Yeah, well,
And
the
I got the
truth.
job. I
Yeah.
mean, did it
See, they
matter?
say that in an interview, but maybe people do wanna know who the real person is that
No, I
they're
think later
interviewing.
on they must have had a secret file where they wrote down all the weird things people did in loops, like in interview loops. And I'm
Yeah.
definitely on the list. She ate carrots.
She ate carrots. Well, I'm the girl who hugged you when she left.
Yeah. I'd rather be the hugger than the eater.
Oh, man.
Oh my goodness. Um, when someone comes for a consultation with you for the first time, what is that like?
Uh, yeah, I love new patients. It's so fun to go over the whole consult. So, if we're talking injectables, right?
Yeah.
Okay. I was like, "Is this surgery? Is it what route are we going?" Yeah, so it's fun, especially I love, like, patients that have never had any treatment ever too. It's so fun to, like, go through all of the different things, which sometimes can be overwhelming, but I try to make it as simple as possible. But yeah, we just pop into the room, sit down, and then typically I'll ask patients, like, what they're concerned with first or what brought them in. And usually I mean, obviously there's a reason they came in, whether it's just, oh, I'm looking older or, oh, I don't like these lines. Sometimes it's more specific and sometimes it's not. And then I like to go through your whole entire face. So you may have come in for your lips, but I'm like, well, while we're here, let's just talk about everything. And so I kind of just start from the top down and then see all of the things that I'm seeing, which I see different things than what sometimes patients will notice, or often it's, oh, I didn't know that was something you could fix, or I didn't know that was something that is in the realm of injectables. So it's nice to kind of bring that attention. And I definitely don't consider myself a pushy person at all. So I just like to I like to educate. So I'm giving all of the options. I like to write it down on like a little pamphlet that we have, talk through what I recommend and then what the patient decides they are interested in too. And then we kind of just go together like, oh, I came in for this, but this sounds like a good idea instead. Or, I want to do both. Or maybe down the road, that's something to think about is often a good one too. And
Do
then,
you will treat on the same day as the
oh, for sure.
consultation?
Yeah.
Yeah.
Yeah. I mean, it's always like time dependent. So it's nice to know if patients are they're hoping to get treatment that day.
Yeah.
But depending on what it is, I like to do something while you're
But
there.
you don't have to.
Oh, no. No, no. If it's like a longer treatment, then we typically will schedule it out. But it's nice to know ahead of time too what you're getting into. Like, especially if you've never had anything done before, then we'll be like, okay, you're coming in a couple of days. This is what you're going to do the day of treatment. This is what to expect when you come in. And sometimes that gives people peace of mind to not have to do their treatment that day, so they can get all ready for it.
Mhm.
But if they want to, then we go for it. Patient leads the journey.
Yes, always.
Yeah.
Sometimes we have to go somewhere after our treatment, and we can't do everything we wanna do on the same day.
Totally something to consider. So
Yeah.
it's usually, okay, you want to do this today? What's your next week look like? Are you doing family photos tomorrow?
Tomorrow. Are you
Then
getting
maybe
married
not.
on Saturday?
Yeah. Oh gosh. Yeah, probably not a great idea.
No, I think you need, what, a month before a wedding at the least?
Oh, yeah, I'd say a month. I would personally feel comfortable with a month. If you come in a couple of days before, I can't. I'm too scared. Nope.
Too risky.
Yeah, but a month is safe. If you can go longer, then great. Then you can talk about skincare and all of that. But some things are multiple series treatments, so that's why the most amount of time you can allow before like something major is great. And if
Mhm.
it's like, oh yeah, I'm getting married in 2 years, we can wait. We can just start skincare and then okay, this is what you're doing 3 months before we're getting lips done. This is what you're doing a month before we're getting your tox done. uh,
Exactly.
yeah, you map out the journey.
It's good to have a partner for that too, who knows.
Absolutely.
Yeah,
Yeah.
and a
It can
plan.
be it could be overwhelming if you're just, you know, nobody's guiding you.
For sure,
Yeah.
especially if you haven't done any treatments before, and lots of brides are, younger and maybe haven't come into a
Mhm.
med spa before. Yeah.
Yeah. Or
We
they
should
think
talk
they
about
need,
that
yeah, or
someday.
it's like you think you need things that you don't necessarily need. I mean, that comes up too. Like, oh, I need filler here. And I'm like, actually, that looks really good. And if we were to add filler there, then it's going to cause this look that isn't good. So it's also nice to have somebody that tells you no. So you wouldn't
Yeah.
necessarily know that as a patient of like, oh, that's how it looks overdone. Because I don't want people to look overdone. I want it to look like, oh, refreshed. I just look, oh, she looks good. She looks youthful. What'd she have done? So somebody has to stop you and know enough to be like, oh, don't put the filler there. Do put it there so that it looks natural.
Do you feel like Portland has a look or a style when it comes to facial non-surgical aesthetics?
I mean, I think that most patients in Portland are leaning towards a natural look. And maybe it's especially our patients because we are a plastic surgery office. So patients know that we're not, that, we work with surgeons. We aren't, a little closet med spa. I don't know.
Well,
I think it
Oregon's
attracts a
laws
different
are,
audience, but
yeah, I mean, you're raising a good point because Oregon's laws are a little more relaxed around injectables than other states. So you have a lot more med spas there that are smaller. And
yeah,
am I right about that?
absolutely. Yeah.
Yeah.
There's
That may not
definitely
have a
different laws
doctor
here.
or a plastic surgeon on site.
Totally. And there are some incredible med spas and that don't have
Mhm.
that, but it's just, you have to be diligent about who's going to be your injector and where you're getting treatments done. So,
What
it's
questions would you ask if you were going to see a new injector?
good question. I mean, one really big one would be, what do you do if there's a complication? So if somebody doesn't know the answer to that or doesn't have the supplies to treat that, then that would be a big red flag. I mean, one of the medications that you have to have on hand to treat a complication is expensive and you need a lot of it. So some smaller places, might not want to carry as much on hand. That would be something to worry about. Another big one is making sure that there's somebody you can get a hold of after hours. We are a plastic surgery office, so if there's a complication, you can get a hold of us in the middle of the night. I mean, I don't know if that has happened here, but it happens. I mean, we're on call on the weekends. I answer the phone on the weekends. So if there's an emergency, it's nice to know there's somebody you can get a hold of rather than if you don't. I mean, I guess I don't know. I haven't worked in another med spa, but I don't know if they have somebody on call
I don't
24
know
hours
either.
a day. Um, I know in family medicine, that's not normally the situation. So,
No, I've heard many a story where the patient has to go to the ER
uh huh.
because
Yeah.
there was no one to call in the middle of the night.
So, and I actually have had a lot of patients that are saying, "Oh, well, what can I contact you?" And I'm like, "Oh, that's really smart of you to ask." But
Yeah.
I mean, it might not necessarily be me that is going to answer the phone in the middle of the night every time, but um, there is a way to contact our office if there's something comes up. So that would be, I mean, maybe it's because I'm in this world and that's something that I think about, but I wouldn't want to go somewhere that I can't figure that out. Also, like I was saying before, like an injector that will tell you no is probably a good sign. So if they're just telling you yes to every treatment you want to do and like it, that they're just trying to make money off of you. So
Yeah.
you want it to look good. Or if like somebody comes in for something and then you give them other recommendations, you kind of it has to be a feel thing too. Like, am I feeling like this person's being pushy or am I feeling like this person's actually giving me good advice and recommendations? So, you know.
So other than your beautiful baby, who's about to be 1,
I
so
know.
hang on, just hold on to it. Mine's about to be out of preschool on Friday. I will not have a
Oh.
preschooler ever again in 3
Oh,
days.
wow. Yeah, that's a big step.
I know, I'm
Ugh.
really sad.
I know, I can't
But
think about that. If I think about him, like, going to college, I'm like, "So, where are we going to college? 'Cause I'm coming with."
right? I
Ugh,
know. Tell
it's crazy.
you guys can live at home forever. It's fine.
Yeah, it's fine.
What do you guys like to do, with with your baby? What do you like to do when you're not at work?
Uh, well, my most common activity is wine tasting.
Well, you're in the right place for that.
And he comes with. He's, like, really good at chilling at the wineries, so Yeah, my best friend and I both have babies, and we're both very into wine. So we bring the babies. I'm very good at finding the baby friendly wine places where not only do they say they're baby friendly, but they actually are.
Yeah.
You know, like it's fine if your baby's crying a little bit or if he's like crawling around. You just have to go to the right place with the right setup.
Yeah.
So that is my favorite thing to do. I would say I probably go like once a week.
So, do you have a favorite winery?
Ooh, that's a great question. I'd probably say Domaine Roy, which is in like Dundee area. I'm a member there, so I love it. Like wine is fantastic, views are fantastic. The like architecture of the building is beautiful, and the people there are so nice. So that's my favorite right now.
Now, when your patients come in saying, I heard you love wine, you're going to know where they heard it is right here on the podcast.
Great.
Or
Well, I
on
have
the
all the
YouTube
recommendations,
channel.
but also if patients have recommendations, I steal a lot as well. So I will take
good.
any of that.
Okay, submit your wine recommendations
Yeah,
to
please
Geneva
do.
on Instagram at MD Beauty Lab.
Love it.
You have your own Instagram handle too?
I do. I would love to be more active on it, but you know, I am a little bit. Let me see. I am that good at it that I don't remember what it is. Okay. It's plastics_PA_Geneva.
Got it. I'll
Plastics
make
PA
sure we
Geneva.
put it in the show notes so it's easy to find. And where else can we find out more about you?
On our website. Come in and chat. I'm on plastic surgery or Portland Plastic Surgery website and MDBL. So check me out either way.
Thank you so much, Geneva. It was really great getting to know you.
Nice to chat with you.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering an appointment with this provider, be sure you let them know you heard them on the Meet the Injector podcast. Check the show notes for links, including the Injector's website and Instagram to learn more. Are you an aesthetic injector or do you know one? You can be a guest on Meet the Injector. Book your free recording session at meettheinjector.com. Meet the Injector is made with love in Austin, Texas, and is a production of Theaxis, TheAxis.io.